what you need to know if you have any kind of heart disease is you need to know why. Why is it happening? So, for example, I had a young woman who had dilated cardiomyopathy. So she goes to the cardiologist. Dilated cardiomyopathy means the heart just is not pumping very well, and dilated means it's big. So she has this big floppy heart that's just not pumping very well. So she goes to the doctor. The doctor gives her a beta blocker, and then her blood pressure's dropping down. She's getting dizzy. So he takes her off that and puts her on another ACE inhibitor, so that to drop her blood pressure, so that her heart doesn't have to work as hard. But never bothered to figure out why. So we started doing tests. I had an ultrasound done called the TEE, where they put bubbles in to see if there's a hole in the heart. And she had a hole in the heart. And what it means is you have the right side that pumps and the left side that pumps, and it's all one heart, and it's going like this, but there's really two completely separate sides. One side pumps to the lungs, and the other side pumps to the body. And so that's how the heart is working. It looks like it's all one heart, but it's really two separate pumps. Well, there's a septum between the two sides, and she had a hole. And so the blood from the left side, which is higher pressure, because it goes all to the body, is squirting over to the other side and going into the lungs. So the lungs are getting higher pressure than they should. And we did some other tests to find out all about that. And that was all. That was why we did the ultrasound. But I'm kind of cutting to the chase here. The point is, without the doctor was starting to put her on medication, and she's a young woman. She was 35 at the time. Now she's 36. She just called me yesterday, and she's pregnant and very happy because she wanted to have a baby. And with the dilated cardiomyopathy, they said, no, you shouldn't have a baby. You're going to be on these medications and all that stuff. And now she's off all the medications because we had the hole in her heart fixed. And so now it's working properly. And so now she's pregnant and she's very happy. And it's because of finding the cause of the heart problem. So if you have heart disease, find out why. Not everybody has the same thing. For example, what if you have clogged arteries? Is it a cholesterol problem? Well, for the large majority of the people, remember we talked about cholesterol being a cause of heart disease, very minor. So a few people are going to have a cholesterol problem, very few, okay? So what about the majority? What are they going to have? They're going to have clotting problems. So either they're clotting too much, they're doing damage to their arteries that are causing clots, or they're not repairing their arteries once they're damaged. So you can make a clot and damage the artery, make a clot and repair it, and you won't even notice it. Nothing will happen. You're not going to get any clogs. You're not going to get any atherosclerosis, and you don't have any heart disease from that. That's the normal functioning. But what if you have a problem of clotting where you clot easily? Then you're gonna form these clots in your artery, and you're gonna clot more than usual, and those clots may not dissolve. So then you're gonna get hardening of the arteries, atherosclerosis. What if you have a problem that causes you to do damage to the lining of the arteries, like you don't make the endocalyx very well, glycocalyx of the endothelium very well. Or what if you have a problem of not repairing well? And that could be just stress. When you're stressed, you have high cortisol. Cortisol blocks the APCs, they're called, progenitor cells, from fixing the lining of your arteries. Or what if you have a high lipoprotein A, Lp(a), that doesn't allow your clots to dissolve? So you make a clot and you pave over it and it looks okay, but that clot still stays in the wall of your artery, and then it starts forming calcium deposits, and then you get hardening of the artery. So all of those are different reasons for the same problem. That's why you need to know why. If you don't know why, then you don't know what to do about it. If you know why, then you can do something about it. So if all you do is say, you go to the cardiologist and they say, well, you got a 30% blockage of your arteries. Let's wait till it's about 50%. We can put a stent in there, right? Or let's just wait until it's like 70%, and then we'll crack your chest open and do a bypass surgery. We'll cut a vein out of your leg, and then we'll take that vein and cut into pieces, and then we'll put the vein around from one part of the artery to the other part to bypass that blockage in your artery. And that's being done every day. These are the most common surgeries done. So if you think about that and you go, okay, doctor, so you want to, because I have these like 3 blockages, and so that's risky, right? I could have a heart attack any day now and die. Yep, that's a problem. So what happens if I do the surgery? Am I more likely or less likely to die? Well, if you just look at it overall statistically, it's about the same. So your chances of dying from the surgery or with the surgery are about the same as if you did nothing at all. So why would you even do surgery? Because you don't live longer with the surgery. That's actually never been shown. Every study that's done shows that the length of life is about the same, whether you do nothing at all or bypass surgery. And that's after like getting your chest cracked open. So why would you do the surgery? Here's why. You have less chest pain. That's all. So I had a patient that couldn't walk across the room without getting chest pain, it wasn't walk across the room. He couldn't walk to the mailbox. That was his big thing. He's got to go out. His mailbox is in front of his house on the street. So he wants to go out to the mailbox without getting chest pain. So I recommended some things he could do. He says, nah, I'm going to have the surgery. So he has the surgery, and now he can walk out to his mailbox. And he doesn't get chest pain. So he can walk further and it's fine. That's the benefit of surgery. You don't get angina as much. And that's pretty clear that's what it does. But are there other ways? Yeah, we've talked about other ways. You don't have to do surgery. We talked about ex-President Bill Clinton had bypass surgery, and he started getting chest pain again after several years, and the doctor said, oh, yeah, got to do it again. He goes, what, you didn't do it right the first time? They said, no, they get blocked again. You just got to do it again. That's what happens. He's like, are you kidding me? After that horrible surgery, you want me to do that again? I'm not doing that again. What else can I do? And nothing. There's nothing you could do. You just have the surgery, or you just have chest pain. Those are your only options. He goes, I'm going to look around. So he found someone called Esselstyn, Dr. Esselstyn at Cleveland Clinic, and started doing his program. And I don't know if you've seen Bill Clinton lately. He's pretty thin. He's really changed his diet, and he doesn't get chest pain, and he doesn't need any surgery anymore. And he's completely cleaned out his arteries and didn't have the surgery, didn't need it. So there are other options, but the surgical option is one. Okay, so the other one that we didn't talk about was the stents. What about stents? It makes perfect sense. You got this artery that's blocked. You put this tube in. It's kind of like a spring. You put it in there, and the spring goes bing, and opens up that artery, and it works. It works. So that's great. So what does it do? Well, it actually opens up the artery, and you actually get less chest pain. So again, you don't live longer, but you will have less, or you should have less chest pain. So angina. So if you have what's called stable angina, which means that pretty predictably, if you walk up a flight of stairs, then you're going to get chest pain. Then you can put a stent in, and pretty predictably, you'll be able to walk up the stairs without getting chest pain. So same kind of issue as the bypass surgery. However, You are more likely to get clots because the stents are foreign material, foreign matter that can produce clots. So you have to be on a blood thinner at least for about 6 months until your body kind of paves over that. So then the blood thinners have their own issues. And again, it's not that you're going to live longer. You're not going to live longer from the stents. I had one patient that he had a stent put in, and they put him on a cholesterol medication. And then he had another stent put in, and they put in a higher dose of the medication. Then he had another stent put in, and he did this 5 times. And every time he had another stent put in, because he had another blockage in his artery, they gave him a higher dose of the medication, because they never looked at why. Why was he getting these in the first place? Why was he having clots? Why was he doing damage? Or why wasn't he repairing it? And so we started on a program. I took him off of all that, and we can't take the stents out. Stents, once they're in, and you got him for life. And so he still had to be on the blood thinner because he's got these stents put in, right? But we started looking at the underlying cause and working on that. And then his cardiologist said, absolutely not. You have to be on that and the cholesterol medication. And it's kind of dumb for you to look at the cause, because because nobody really knows. So he never did. He went back to his cardiologist, and I never saw him again. So I don't know what happened to him ultimately.
Wow.
But it's likely, that he's going to get more clots, and then you can't put stents in, then he's going to have bypass, and then probably repeat that again. I don't know. Anyway, so those are the kinds of issues with heart surgery that come up. Other heart surgeries include valvular surgery. Some people that have heart failure, it's because the valve isn't working right. So you got to think that these valves, they let the blood go up, but it can't go down. It can only go one way. It's just a one-way valve. And if that valve is leaky, then it's not one way anymore. It's two-way. Because if the valve leaks, then the blood goes this way, and then it goes that way, and then it goes this way, and then it goes that way. And if your blood is just moving back and forth, it's not circulating. And that's a problem, right? So what happens is when the valve is really leaky, the heart will get big and floppy too, just like with the hole in the heart. So then those often need surgery. And valve surgery these days is amazing. So sometimes they can use a balloon to dilate the valve. If it's really called stenosis, if it's really blocked up, they can put a balloon in there and blow it up and widen out that valve so that blood can get through easily. If it's just floppy and it's not working at all, there's several different types of valves that they can use. They use pig valves, and they also use mechanical valves. And sometimes if you're sitting next to somebody, you hear tick, 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 tick. That's the valve in their heart. And sometimes mechanical valves, you can hear them, some types. And so I had that yesterday. Somebody was in my office and I hear tick, tick, and it's clearly coming from him. And I'm like, do you have a mechanical heart valve? He goes, no, my heart's fine. And I'm like, what the heck? It was his watch. he had one of those old-fashioned watches that actually goes tick, tick, tick.
Oh, that's
tick.
funny.
Yeah.
Oh, go ahead, Cheryl.
I was going to say my mother had heart valve surgery, and she had it replaced with a bovine, I think.
Bovine.
Yeah. So what causes the weakening of the valve then?
There are several different reasons. Some people have Ehlers-Danlos syndrome, which is a connective tissue disorder. And so they don't have really strong connective tissues. So you got to think these valves are taking a lot of beating, and you're not making new valves. And if you have something of a weakness in the connective tissue, then that's a problem. Some people, they form calcium deposits. They're just depositing calcium. And inflammation is happening because of that constant beating of the valve. And so they're getting inflamed and they're getting calcium deposits. So sometimes that causes stenosis of the valve. Sometimes people are born with it. Some people have they have 3 leaves of the valve, and some people have 2 leaves of the valve, and that affects how the valve functions. But you got to think these valves are under a lot of stress. The mitral valve is very common because the mitral valve, it has a tether. It's tethered so that it doesn't go past. And if that little tether cord is stretched out or something, then the valve gets leaky really easily. And so that's a really common thing, is the mitral valve prolapse. But if it's prolapsing too much, then you still have the same problem, that the blood is going 2 ways instead of circulating 1 way. It's going back and forth and back and forth. And you really need those valves. That's really important.